to the Friday Five here on the Agent Survival Guide podcast. I'm your host, Sarah Ruppel, and this is our weekly recap for insurance agents, where we highlight 5 things you should know about. It was a busy week with 2 of my 5 days spent on the road at our annual summits, so that is where we will start our list at number 5. This week, we were in New Jersey on Tuesday and in New York on Wednesday. We had a fantastic turnout, and I just wanted to say thank you so much to those of you who attended. We had so many people stop over to our table, say hello, and ask questions. Just a quick reminder that if you have questions you'd like answered, whether it's about marketing, products in your portfolio, or contracting information, you can send those in to us. asgpodcast@ritterim.com is the email to reach out. We would love to help answer those questions. Next week, I'll be wrapping up my summit tour with one last stop, this time in Ohio. Still plenty of time to register and join us in Cleveland if that is your market. We will have the link to our summit registration in the episode notes. Number 4, we've been talking about disruption in the industry for a little while now, and on both sides of the coin, Medicare and the ACA health insurance markets. More recently, we've experienced quite a few legislative changes and court rulings happening in quick succession. It can be difficult to keep up, especially with everything else agents need to accomplish in advance of enrollment season. Here at the Agent Survival Guide podcast, which is powered by Ritter Insurance Marketing, we try to bring you a variety of resources to help keep you as updated as possible, covering what's going on, why it's happening, who's going to be affected, and why it matters. Recently, Ritter Insurance Marketing CEO Craig Ritter had the opportunity to sit down and talk about that very topic with 2 other industry leaders. Stanton Sasaki, VP of National Sales and Innovation at Scan Health Plan, and John Selby, President of Rebellis Group. They talked at length about what the recent court rulings, legislation, and trends mean for brokers and health plans. Definitely recommend listening to hear their take on recent events. We'll be linking to that webinar in the episode notes, so check that out. Lots of great information you don't want to miss out on. Number 3. Super short mention here on the Medicare front. The 2026 version of the Medicare and You Handbook is now available. This is a great educational resource for Medicare beneficiaries. They should all be getting a copy of it in the mail. I know I've got my fingers crossed that I'll get a physical copy of it this year. Sometimes that happens, sometimes it does not. That being said, this is a great tidbit to add to your client newsletters. Let your clients know that these will be going out soon. You can provide the very same link that we'll be putting out in our episode notes. It is a fairly hefty document at 128 pages. I'm not sure that I would try to print it out or recommend that my clients do so. But like I said, it's a great resource that they can bookmark on their devices. We will be linking to that in our episode notes, so feel free to copy that link and add it to your own newsletters. It is the official Medicare.gov publication, and almost everything has been updated for the 2026 plan year. No cost information just yet, though, as far as premiums and deductibles are concerned. Number 2, on Tuesday, Apple held their awe-dropping event announcing the AirPods Pro 3, the Apple Watch SE 3, Apple Watch Series 11, Apple Watch Ultra 3, iPhone Air, iPhone 16e, iPhone 17, iPhone 17 Pro, and the iPhone 17 Pro Max. I have not yet had a chance to watch the recording of that event. It's on my list, but there's quite a bit on that list at the moment after our summits this week. I am still very much in catch-up and follow-up mode, hoping to catch up on details and report back on them next week. Pre-orders for all of the items announced should now be open. And then on the software front, WatchOS 26, MacOS 26, iPadOS 26, and iOS 26 are all expected to drop on Monday, September 15th. Usually that happens around 10 a.m. Pacific time, so 1 p.m. for those of us on the East Coast. That's the big update, bringing liquid glass to all the Apple devices, as well as some feature updates and new apps. I will be downloading that as soon as I can on Monday, hopefully getting that update in before we get on the road to Ohio. Fingers crossed. And now, moving on to number 1 this week. Let's talk about the recent CMS changes to catastrophic health insurance coverage. One of the disruptions we've been talking about this year in particular is the expiration of the ACA Marketplace advanced premium tax credits put in place by pandemic-era legislation. With those tax credits expiring, regulations around advanced premium tax credits and cost-sharing reductions changing, and ACA plans seeking a median 18% premium increase, CMS has estimated that 22 million people will either see an increase in the cost of their health insurance or lose coverage as a result of these changes. The Congressional Budget Office estimated that just over 4 million individuals would be impacted by not extending the ACA premium tax credits beyond 2025. In an attempt to offset that potential wave of newly uninsured individuals, CMS changed their definition of short-term limited duration medical plans to allow for up to a 3-year short-term medical plan in select states. We talked about this back in our August 22nd Friday 5 episode, which we'll be linking to in the episode notes. On September 4th, CMS announced plans to expand catastrophic health coverage with an additional hardship exemption, quote, specifically designed to help consumers access coverage as a result of the premium increases anticipated for the 2026 plan year, end quote. CMS has created a special hardship exemption for beneficiaries who find themselves newly not eligible for advanced premium tax credits or cost-sharing reductions based on their projected annual income to qualify for enrollment in catastrophic health coverage. This hardship exemption will apply to those with advanced premium tax credits who find themselves newly ineligible by projected annual income if that threshold is below 100% of the federal poverty level and above 400% of the federal poverty level. The hardship exemption will also be expanded to those who make over 250% of the federal poverty level and are only ineligible for CSRs. Couple things to note about catastrophic coverage. Historically, it's always been available to those under the age of 30. Plans must offer the 10 essential health benefits defined by the ACA, just at a lower premium price point. They must cover 3 visits to a primary care doctor prior to the deductible being met. These plans, as defined by the name catastrophic, are designed to offset major financial ruin when a serious illness or injury hits, as opposed to having no coverage at all. They're low premium, high deductible, and thanks to other new legislation, beneficiaries are now able to use health saving accounts with them. In addition to expanding qualifications for hardship exemptions, CMS also announced plans to streamline the application process for those exemptions. Previously, the exemption was a paper application completed by hand and mailed. That option still exists. CMS has added a new online application process. Individuals can apply for the exemption at the same time as they apply for new coverage, either on healthcare.gov or a certified enhanced direct enrollment partner. The expanded exemption qualifications and access begin on November 1st, same day as open enrollment for the 2026 plan year. We will have the links to information on the new hardship exemptions in the episode notes, along with a list of certified enhanced direct enrollment partners and the other resources we mentioned in today's Friday 5 episode. And with that, I hope you have a great weekend. Stay healthy and stay safe out there, and we will see you next week. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an Integrity company. This episode was written and produced by me, Sarah Ruppel. Script editing and fact check by Tina Lamoureux. Podcast design by Urban Rivera. Follow along with our show wherever you like to listen.